good news for cervical cancer patients. The Steve Biko Academic Hospital is the first institution in Africa to use electrical brachytherapy. It's a machine that uses electronic X-ray tubes instead of a live radioactive source. The specialized treatment will also curb Gauteng's massive backlog. Let's discuss this further now with somebody who knows more about it, far more than any of us here, with the University of Pretoria's Head of Oncology, Dr. Sheynaz Bassa. And let me get that correct, the Steve Biko Academic Hospital Department of Radiation Oncology. Dr. Bassa, thank you so much for your time this evening. It's not often that we can say our cancer patients have got good news, but this access to electrical brachytherapy surely is going to be life-changing. Explain to us why.
Yes, and look, cervical cancer is one of the most commonest cancers in sub-Saharan Africa. In fact, we have the highest incidence in the world. And brachytherapy is an integral component of that treatment. What it entails is radiation which is delivered in close contact to the tumor. And this is necessary in cervical cancer because of the fact that we need high doses of radiation in order to eliminate the cancer. And that is not achievable with conventional radiation machines. So as a combination therapy with external beam radiation, brachytherapy is also given to these patients to allow us to get the high doses that we need without damaging the surrounding tissue in close proximity to that.
Now, this comes, of course, also against the backdrop of there being a massive backlog for treatment of cancer in general in Gauteng. What are the causes for that?
I think we had a problem with aging equipment, and which was breaking down very often. And that resulted, radiation treatments are very complex. Patients have to get treatments for about 2 to 6 weeks. They're not treated just when they're seen. Obviously, there's a complex process involved that involves different members of staff that involve in the planning of treatment and the execution of that treatment. And you have a machine treating between 40 to 50 patients. And when these machines break down, what happens is that you have a backlog that actually accumulates. But what's been happening now in the last couple of years, the two big centers, Charlotte and Steve Biko Academic, University of Pretoria, have acquired new equipment. And basically, there'll be 2 new centers also being set up at 2 different academic hospitals in addition to the 2 existing facilities. So these 2 facilities have now been set up with new linear accelerators and are in the process of acquiring new brachytherapy equipment, which is essential for the treatment of various cancers, including cervical cancer.
Now we know in South Africa, our health, the issues and the challenges facing our health department are many. And that's, of course, before you even consider the massive gap in the difference between healthcare that's accessible for those in rural areas and those in the city. Now you're saying these machines are available, from what I understand, in 2 major government hospitals. How much of an impact are you hoping that will have? And how wide of an access will that give people, both in Gauteng and, of course, the provinces lying around it?
Well, there's a massive drive to improve access to radiation facilities, but radiation facilities are complex treatments requiring specialized skills. And so it's not possible to basically install a radiation machine in every single district hospital or a secondary hospital. And so they're often restricted to larger tertiary facilities. And so having more machines and having machines which are much more effective and efficient will allow us to treat more patients more rapidly. The current technology that has evolved over the last few years means that we can offer more rapid treatments and more effective treatments and more precise treatments as well. And there's a drive towards offering shorter courses of treatments which are more effective and much more safer than what we could do in the past. So I think that, and there's also a drive within the government to actually open up more facilities in other provinces. And we are busy training registrars from Eastern Cape and from Mpumalanga in order to basically equip them to go to their facilities, which will eventually one day be set up as well.
I'm sure that must be a massively important part of what you're doing. And then for them to, in turn, work in those communities to educate people about what is now possible in the treatment of whatever cancer it is that they are treating. How important is that? How difficult is that when it comes to new technology that's being introduced? Training and educating staff is one thing, but then to educate ordinary people to understand actually this big, very impressive machine is actually going to help you. How difficult and challenging is that?
I think when patients come to us, they've already have severe symptoms from their disease, and they're quite in distress. And I think it's to basically explain to them how that's going to improve their symptoms and what the goals are in relation to that treatment. So yes, there will be side effects, but in comparison to the gains in terms of controlling their disease or improving their symptoms, and sometimes even most often curing the disease, it's possible to cure disease with radiation treatment. And I think when patients are faced with that option and being told that we offer you something that can heal you and improve your quality of life, improve your symptoms, improve your life expectancy, and possibly cure it, I think that we don't face reluctance with that. So there isn't this hesitancy or this kind of distress about trying all those treatments, because these treatments have been around for a very long time. What has happened is these treatments have improved with time, and that's been a phenomenal achievement in the industry.
The statistic that you mentioned at the start of the interview is one that I've heard before, that cervical cancer or cervical cancer is the second most common cancer amongst South African women, but it's also the cancer women die the most of in South Africa. I've heard that statistic often, especially when it comes to Cancer Awareness Months or days that we often cover. But we haven't often had one answer or groupings of answers to tell us why that statistic is what it is.
Unfortunately, cervical cancer afflicts women in the lower socioeconomic communities who often don't have easy access to care. And also, cervical cancer is preventable. You know, cervical cancer screening will prevent a large number of cases of cervical cancer. But obviously, women are not educated or exposed or don't seek out screening opportunities. You know, there's health-seeking behavior or preventative behavior, and that needs to be improved. Because if you can screen for cervical cancer, you can detect it at a stage even before it becomes cancerous, and you can intervene at that point in time. And that's through a simple tool, which is a pap smear, which there's been modifications or improvements of, and is available and accessible at local clinics as well. In addition to that, now there's the HPV vaccine, which there's been a huge rollout. It's given to girls between 12 to 15 years of age, and that impact will only be seen about 3 decades later.
Sure.
And so we hope in the future that the incidence of cervical cancer will decline with time.
Okay, we can only wish you and your team everything of the best and all the best with this wonderful new technology that we hope will make a massive difference in the ongoing challenges that your team faces as we help so many South African women battle this scourge. That is Dr. Sheynaz Bassa. She is with the University of Pretoria's Steve Biko Academic Hospital and is the head of the Department of Radiation Oncology. We thank her for her time.